we'll go ahead and get started. Is that
This one
okay?
doesn't say original.
I know.
Oh. Lots.
All right, good afternoon, everyone. Thank you for being here for our Wednesday, June 2nd, Pershing County Board of Health meeting. I'd like to call the meeting to order. And would like to see if anyone is willing to move to approve the minutes from our last meeting.
I'll move to approve the minutes from May 2nd. Yeah. And I'll second that.
Okay, so all in favor, say aye.
Aye.
Any opposed? Okay, so we will move to officially approve those minutes. Thank you. All right, going to item number 2, public input, public comments and discussion. No action may be taken on a matter raised under this item of the agenda until the matter itself has been specifically included on the agenda as an item upon which action will be taken. Public commentary will generally be limited to 3 minutes per person. Any comments?
Nobody on there, Justin?
Do we have anyone on? Okay, perfect. All right, so we will move to item number 3, COVID status update. All right, so as of today, at this moment, total cases in Pershing County is 969. That includes 205 community members, 20 deaths is where we're still holding. 20. So in the month of May, we had 15 cases, no hospitalizations. In April, we had 11 with 2 hospitalizations. In March, that was our lowest month of 4. So we are definitely seeing a little bit of an uptick. We had a little outbreak and I haven't seen any in the last few days. Sometimes there's a little bit of a lag and a break with the holiday and everything, but as of my last email check today, there were no new positives reported by the state. So in regards to disease investigation and contact tracing, everything is pretty much the same there. Testing, we are doing more rapid tests, the PCR tests through the clinic and the hospital. We're trying to send out for those who agree to be re-swabbed to go to the state lab for confirmatory and sequencing for the variants.
So they just like make an appointment to come in and get tested or something?
So if they're sick, then they are offered a swab there at that time. And if it's like a contact tracing person and we assume they're going to be positive, then we'll ask if we can swab them for both at that time. Yeah. If it's just a new person and it's a suspected, then we will do the swab for the ID now, the rapid. And if it's positive, then we'll usually ask them to come back. As we all know, it's not super fun to get swabbed, although it's also not the most horrible thing in the world. So as of today, the most recent report I've received is the sequencing or lineage of the variants that we have are pretty much similar to what they were before. The primarily predominant cases that we see here are the California variants. So we do have variants of concern in this county. We did have our first confirmed breakthrough case of somebody who's been vaccinated who got ill. She was around other folks who were positive, and that person has mild symptoms and is recovering. So again, vaccines are 95% at best effective in preventing this illness. It's very likely to prevent serious illness and death. So that's the importance of the vaccine. Vaccination efforts continue. We're happily still scheduling pretty much every week in the clinic, but getting 10 people per clinic day to vaccinate. We did 10, or wait, no, we did Pfizer. I don't remember which we did yesterday, but no, we did 10 Moderna yesterday. So that was great. The health nurse is still continuing to vaccinate as well. We have gotten some children vaccinated. We did 4 in the clinic, and I think that the health nurse had 2 scheduled today. I'm not sure if they showed up. Is Marcia or Cheryl on? Okay, so I'll try to get an update from them about that. And I'm going to have Tyson speak in a minute about the outreach we've got some information on for the schools in regards to the vaccinations for the children. Mitigation efforts and PPE continue to be the same. Masks are still recommended and required in many places. So because of the variants, it's really important that we still, in certain settings, wear a mask. Especially if you are not vaccinated, then it is still recommended that you mask everywhere. Outside, if you're in a large group, that's also important. If you're inside and vaccinated, then you can go without masks, is the current recommendation. There's no way to really, verify or confirm that someone's been vaccinated unless you ask them to show a card or an immunization record. Some places do request that. Travel is going to be one of those. So we'll just have to see how things go. I don't see mask recommendations or requirements going away anytime soon. I don't have specifics about that. Vaccination boosters are in the process of being developed to include some of these variants. I don't have details on that yet either. So as we get more information about that, we'll let you know.
So that'd be like a one-time shot or something, no boost.
Yeah, it's like a tetanus booster you get every 10 years. This will be a booster that I don't know how long down the road they'll be, recommended. They're still doing ongoing research about how long the immunity lasts from vaccine. It does seem to be that you're getting longer immunity from the vaccine than you are from the illness, which is why they're still advising folks who've had COVID illness to get vaccinated. You have about a 90-day window of being protected if you are ill with COVID, maybe longer if you've had a serious illness, but that immunity seems to wane quicker than if you're vaccinated at this time. The mRNA vaccines, per the most recent update, is considered to be the most effective one versus the adenovirus. Vector vaccine, the Johnson & Johnson, but it's hard to know if that's because there's only one vaccine required for the Johnson & Johnson where you're boosting with the mRNA ones. So lots of research still ongoing, and we'll get updates as they become available. So Tyson, are you on?
Yes, I'm here.
I'd like to give an update about what's been going on with the school efforts.
Yeah, so we looked into creating a Google form to try to get as many parents to let us know their children ages 12 to 17 would like to have their kids be vaccinated. So several social media websites and county website and school websites were gracious enough to get those posted. And we had, we're at a 76 individuals reported. We have up to 26 individuals who would like to get that vaccine. And in the schools, we got a count from all the grades. So this would include ages from 11 to 18. But there's 306 students in our middle and high school. Again, includes the 11 and 18-year-olds. And then the test, of course, only asks parents. So hard to say, maybe we have 25 to 50% people reporting, and it's still ongoing, but it gives us an idea on if we should do a pod or if we should have everyone contact the clinic or go through the community nurse to get these kids vaccinated. That's where we're at.
Thank you very much. So we're going to continue reaching out to the schools, and we will offer during athletic pre-participation physicals if they would like to get their kids vaccinated. Other kids going off to college, some colleges are requiring vaccines, so we'll just have to keep playing it by ear. State sent out some information to me a week or so ago about the vaccination rate for children per county for flu vaccine. And I think they kind of estimate it's probably going to be about the same amount of uptake for people who may want the COVID vaccine. In 20 to 21, their estimates for ages 12 through 15 are 315 kids with an 18% flu vaccination rate. So still not quite all the numbers that we would want to try to correlate, but based on the numbers that we're seeing, it's probably going to be 15 to 20% of kids that are interested in getting vaccinated. So still encourage it. I do recommend it. Pfizer vaccines are what we're using for the under 18 group. The state has made it much easier to get that vaccine to us for a couple of different reasons, just because we need it available in the rural areas, but also the relaxation of the requirements for storage if it is unreconstituted. So these come in little vials that you have to mix a diluent with. If it's unmixed, it can be out of the freezer for 30 days. Once it's mixed and ready for vaccine, it has to be disposed of after 6 hours after mixing. So that 30-day allowance of being able to be in the fridge instead of a deep freeze is giving us a little leeway. The other barrier was that they had to ship 1,070 doses or something per shipment. They now have central storage available in Churchill County and in Humboldt County with the deep freeze, so they can ship the big bulks, and then we can trade between counties and get smaller allocations of that vaccine. So it's easier logistically for that reason as well. So it's been pretty smooth. Marcia, our health nurse, has done a wonderful job at helping us transition and get the doses that we need for our clinic and for her clinic here as well. So very appreciated. Moderna is hopefully going to be approved for under 18 soon, but I don't have details on that yet. Let's see. So PPE, I think we're completely good on. That's all I have in regards to the update. I don't know if Sean is on or if Marcia joined, if anyone has any other updates in regard to status.
Good afternoon, Dr. Sean here.
Hi, Sean.
Nothing significant. Hey, good afternoon. Nothing significant to report. State has really started to dismantle a lot of their staffing associated with COVID monitoring, and Department of Emergency Management is starting to transition back to normal everyday operations. That's the end of my report.
Thank you. Yes, many of the meetings that have been ongoing from the state and many other agencies under this are winding down, which is kind of nice and kind of scary at the same time. Because this is not going away, unfortunately, but I think we all have a better handle on it now, and cases are down. I think vaccination is, progressing, and hopefully we'll continue to not see serious illness and death. All right, so we'll move on to item number 4, Pershing County's recovery plan. So we assumed our local jurisdiction last month, and there was a question brought forth about whether or not we should propose approval prior to large gatherings with Frontier Days coming up and other things that go on during the summer. The state, Carol, you spoke with
Caleb,
Mhm.
and he said the state no longer requires that, so it's just up to us.
Mhm. So I will put it out there for anybody who would like to make their opinions known or concerns known about whether or not we should require an approval process.
I don't think so.
And I don't think we need one. My only concern was for you, whether or not you felt it was necessary.
Yeah.
Well, I think, if we don't see a huge bump in serious cases and burdens to our healthcare system, then I think that we can move forward without requiring
Without,
that. But if we see
if something changes, then we'll have to fall
Yep.
back.
as is everything with COVID,
Yeah.
nothing's easy. And if things change, we have to reevaluate and adapt. So I think that it's fine to proceed, but with all the usual recommendations that are still in place. Wear masks if you're unvaccinated. Social distance with people you don't live with. Wash your hands a lot. Stay home if you are sick, please. Even if it's not COVID, please don't share the germs of anything. Yeah, so I know it's been a very long 15 months. We're all tired of COVID. But it's still here. So let's be vigilant. Let's respect each other and try to just do the right thing. All right, so we will agree that we do not require pre-approval for large gatherings at this time. If the cases and impact on our community changes in regards to COVID, then we'll reevaluate at that time. Okay, moving forward to item number 5, updating regarding school, business concerns or needs. Tyson talked about the vaccination possibility for the kids in school. If there's a need for large numbers to be vaccinated, we will definitely coordinate with a health nurse or just do it through the clinic and hospital and offer a group vaccination if that's needed. If there's not a huge uptake, then we will probably just do them in clinic like we're doing them now. The summer months tend to be a little bit slower overall in the clinic, thankfully. Let's knock on wood. So hopefully this will not be an issue and we'll be able to get that done without any trouble. I'm not sure if there's anybody on or if anybody here has any questions or concerns about school stuff or business concerns in regards to COVID.
Nobody on from the school?
School is out tomorrow. Is that it? Tomorrow's the last day. So then we move forward with summer fun.
Yeah.
It's really hot out there. Everyone stay hydrated. Wear your sunscreen. Okay, so if there's nothing else, we'll move back or move down to item number 6, update for Board of Health Information Dissemination. So we continue to work on that. County web pages, Frontier Community Coalition, Facebook, newspaper, flyers as needed when we can get them out in certain settings. Are there anybody have concerns, issues, recommendations, or anything we can change in that regard? Nope. Okay, so I think it's been going pretty well. Thank you to Tyson for pioneering the communication with the school district and opening up that chain of discussion in a more effective way. Really appreciate it. Okay, so I think there's nothing else here. So down to number 7, announcements, future meeting dates and agenda items.
Excuse me.
Goodness. Are you okay?
There's a doctor, there's a doctor close by.
Do you need your mask on? Just kidding. Okay, so announcements, we've kind of talked about everything else. Does anybody have anything they would like to bring up, announce, anything? Okay, so in regards to future meetings,
Do we still need to meet monthly, do you think? And I had only reserved the room. This is the last meeting I reserved the room for.
So prior to us bringing this board together, there was not any official formal meetings for our Board of Health. So I am thinking 3 months, just as a touch base.
2 or 3.
3,
3 quarterly, something like that.
June, July, August. So September.
September.
Do you want to do it the first Wednesday in September, or what would you like?
Maybe we should do it the last
The last commissioner meeting,
of
maybe?
The last one.
August.
So the first one is on the 1st and then the second one is on the 15th.
Now we're coming up to a holiday weekend. Well, do you want to do it before school starts or after school starts? I guess that would be the question.
Yeah,
Well, school starts probably the 23rd.
Okay. So what do you think?
So if we did
Middle of
August
August?
18th, is our regular meeting.
You guys want to do that? It's like
Yeah.
2.5
Sure.
months.
1 o'clock on August 18th.
Check in before the school starts, make sure we're all on the same page. Okay, so August 18th, will that be the same 1 o'clock?
Yep.
Okay, and so will you request that for me?
I'll
Thank you.
request the room, yeah.
So 8/18/21, 1 PM for the next meeting, and then we'll look at going, quarterly, or if things really calm down every 6 months or something. I'm not sure what you guys are looking at, but depending on other events in regards to health as well. Okay, any agenda items that we want to include for upcoming meetings? Anybody?
I don't think,
Well,
other than what we have.
we'll continue on the same kind of general vein, and we'll see if there's anything else that comes along in email. Please feel free, anybody, to email anytime if you have items that you'd like to have included. And if anything significant changes regarding numbers or variants or anything that I think needs to be disseminated, I will definitely email that out, and we can post on the web page if there's anything of concern that needs to go out to everybody. Okay, great. So August 18th, 1 PM for the next meeting. And then we will move to item number 8, public comment. Public comments and discussion. No action may be taken on a matter raised under this item of agenda until the matter itself has been specifically included on an agenda as an item upon which action will be taken. Public commentary will generally be limited to 3 minutes per person. Any comments?
Good job.
You guys are so quiet. Okay, then we'll move to adjournment. Everybody have a wonderful day.
Thank you.
Stay safe and well.
Thank you
Thank
very
you.
much.
You.
Thank you. Okay, so you don't need to do anything special, you guys. Just do your usual thing and keep everybody well.